Good afternoon. My name is Lily Tunney. I am the co-founder and director of HealthLinks at the Center for Health, Work, and Environment, where I direct our outreach and practice projects. We are running the 8th installment of our town hall series focused on providing credible and updated information to employers and individuals affected from this pandemic. So we are very excited to bring this topic to you all today regarding the health and safety best practices for return to work. We're starting to see handfuls of guidelines come out by the day around this topic, and we wanted to provide you with a brief overview of what's most important to be considering right now, with the caveat that these are most likely going to change between this week and next week. And we're hoping for a lot of questions from you all here today, and we'll be providing an opportunity to be joining us on a weekly basis to have more discussion about this. So this is really meant to kick things off. To give an introduction and background to who we are if you're joining us for the first time, HealthLinks is a total worker health-based program based at the Center for Health, Work, and Environment. We're one of 6 national centers of excellence for total worker health and one of 18 education and research centers funded from the National Institute for Occupational Safety and Health. The mission of HealthLinks is to provide assistance through advising, assessment, certification to employers for advancing worker health, safety, and well-being. So everything we do focused in research, education, and practice is based on this mission. Some general housekeeping rules for the town hall. All of the attendees are placed on mute throughout the duration of the presentation. So we have Katie Guthmiller, who's our Total Worker Health Program Coordinator, who's on the back end and will be monitoring the chat. If you have any technical issues, please make sure to go ahead and type those in the chat function. And then we have a lot of time dedicated, about half of our time dedicated to a Q&A. And so as this time goes on, please type your questions into the box in the control panel on your screen. The webinar is going to be recorded, and we will send that link on that YouTube link out to all of you by tomorrow. The slides as well will be shared. And at the end, there's a quick 2-minute survey that we're going to ask you to complete pretty please, so we can get some idea of how this went for you and some feedback on what would be helpful moving forward. So today, the presentation is going to be covering meeting local, state, and federal requirements for reopening organizations, implementing policies and procedures, best safety measures for protecting employees and businesses, and then really discussing protocols for starting and continuing operations. Our speakers today are Dr. Lee Newman, Dr. Mike Van Dyke, and Dr. Catherine Buchema, who I don't have a photo of, but you'll see her face during the panel discussion. Dr. Lee Newman is a distinguished professor in the Department of Environmental and Occupational Health and Epidemiology at the Colorado School of Public Health. He's the founding director of both the Center for Health, Work, and Environment and the Mountain and Plains Education and Research Center. He's a professor of medicine in the Division of Pulmonary Sciences and Critical Care Medicine at the University of Colorado Anschutz. And he's recognized globally for his scientific and practical contributions to occupational health and safety, total worker health, immunotoxicology, and medical surveillance. Dr. Mike Van Dyke joins us as Associate Professor in the Department of Environmental and Occupational Medicine and Director of Continuing Education at the Center for Health, Work, and Environment. His over 20 years of experience has been spent at the academic, community, clinical, and government levels in professional practice, research, and education. He's a certified industrial hygienist and is recognized for his contributions related to exposure assessment, beryllium exposure, first responder exposures, indoor air quality, public health aspects of legalized marijuana, and community exposures related to oil and gas extraction. And Dr. Catherine Buikema, who will join us for the panel discussion, is the chief resident of the occupational medicine program at the University of Colorado Anschutz. She served in the US Navy for 8 years, and during that time, she worked as a physician in the occupational medicine clinic for a large government agency with over 30,000 employees. She has a Master of Public Health from Tulane, a Bachelor of Science in Journalism from the University of Colorado Boulder, and she attended medical school at Western University of Health Science. So please help me welcome our distinguished speakers today. And at this point, I will ask Dr. Van Dyke to go ahead and share his slides, and we'll get started. Thanks again for joining us.
All right, I think everybody could see that now. So it's a pleasure to join you from my basement. I'm not sure I've ever talked to 300 people all at once from my basement before. So every day is a new experience these days. So before we get started, I want to really put out some disclaimers here. I want to first say that today's discussion will really be focused on non-healthcare environments. I think there's been a lot of discussion on healthcare environments in other places, and not enough discussion on non-healthcare environments. Also, the information presented today is current as of today. It's going to change frequently, and please stay up to date with that information, and hopefully we'll be able to have more of these in the future to help everybody stay up to date. One of the important things I want to get across today is that we're going to talk a lot about COVID prevention strategies. And I want to make sure that everybody understands that everything we're talking about today is really based on the best available science. But there's still a huge amount that we don't know. And one of the biggest things we don't know is how effective these practices are going to be in preventing COVID in the workplace. And that's mostly because they haven't been fully evaluated yet. And then finally, importantly, the discussion will be focused on national and Colorado guidelines. If you're somewhere else, make sure you think about other guidelines and public health orders in your state or municipality. So with that, unless people have been living under a rock, we all have seen what's going on out there. But we may have missed some of these stories where you have a single worker in a factory in Ghana that infected 533 other people. I'm sure a lot of you have seen stories about meatpacking plants, places like Tyson, where they have over 4,500 workers with positive COVID tests. And then, not sure if people have seen this one, but I thought this one was really important to bring up. This just shows the impact a single person can have, even with a fairly short-term exposure. And this is a story about a choir practice where there was one symptomatic person, and from that one symptomatic person, there were over 52 cases identified after a single choir practice. So this really brings into focus the importance of all these things. But in case we needed one more motivating example, one of the few studies that's been published so far in terms of coronavirus in the workplace was published in South Korea. And this is coronavirus that occurred in a call center. And what we see here in this graph is data that shows, when the first case showed up at work, and this first case here in yellow worked on the 10th floor, and we're really going to be focused on the 11th floor. So we had a first case show up on the 11th floor on February 25th of this Korean call center. And 13 days later, we really had 76 cases on this single floor. So this really translated to an attack rate of about 43% of the workers on that floor ended up being diagnosed with COVID. And just to give you a picture of what it looked like in that workplace, which I think it's helpful for all of us thinking about workplace exposures, as you can see here, the call center is kind of on the top half of the slide here. And you could see those people who were diagnosed with COVID were working in relatively close proximity to each other, which shows what we've been talking about for a long time, how close contact is really the most important thing to avoid with this sort of disease. Now, I know everybody thinks about, having a case of COVID in their workplace and concerned about people getting sick, concerned about people getting severely ill. But the cost to a business is also important. To think about, if you get one case of COVID into your facility and 13 days later, 43% of your workers are sick, that's a huge cost to business. So that's one of the reasons we're talking about this today. So before we delve into the real prevention strategies, I want to make sure we're all on the same page in terms of how COVID spreads. And COVID spreads through viral particles that are expelled through coughing, sneezing, speaking, and exhaling. We really talk about two modes of transmission. We talk about this droplet transmission. And if you look at the picture on the right over here, you could see really this is close contact, somebody speaking in very close proximity to another person. The large droplets get on the person and can infect the person. The other thing that we think about is close range aerosol transmission. And that's a little bit different than droplet transmission in that many of these particles that get expelled by a person remain airborne for some time. So close range aerosol transmission is thinking about this person A expelling these particles, and at some time later, this person C being exposed to those viral particles and potentially developing an infection. So those are thought to be the main two ways that this disease is transmitted. But we also worry about contaminated surfaces. So all of these particles that people expel settle onto surfaces. People touch those surfaces, people touch their nose, they touch their mouth, and they can also be infected in that way. So all of these routes of transmission are things that are important to consider in the workplace. It's also important to think about how long people can be quote unquote contagious. What we know is that there's high levels of viral shedding, even at the earliest stage of illness. And this is at the stage where people might have no symptoms whatsoever or only mild symptoms. Many of these people really haven't established that they're even sick. So high levels at these early stages are really important. And then viral shedding appears to decrease after about 5 days in those with mild symptoms. Those with more severe symptoms can continue to shed virus pretty significantly beyond 10 days. And then even after people are recovered, it's been shown that people can shed low levels of virus for up to 6 weeks. And, there's some question about this 6 weeks in terms of whether they're shedding enough virus to really be a big infectious risk, or whether the virus that they're shedding at this time is even infectious. So we really think about those 2 weeks as the main time. But in terms of a workplace, the thing that's really hard is this high levels of viral shedding, even at the earliest stage of illness. When somebody has mild to no symptoms, it's really hard to figure out they should be excluded from the workplace. So now that we're on the same page in terms of spread and how it's spread, we really want to think about what are the guiding principles for preventing COVID-19. And I came up with these 7 principles, really trying to keep it as simple as possible. And the first principle is keep people with COVID-19 out of the workplace. Next would be keep people at least 6 feet apart in the workplace. And we're going to talk about each one of these individually in a minute. Use barriers and face coverings when closer than 6 feet. Wash hands often. Clean and disinfect surfaces often. Communicate across all organizational levels. And then really hope for the best and prepare for the worst. So when we think about these individually, we need to take one step back. And the one step back is before you do anything else, when you're starting to think about return to work, you need to assign somebody to be in charge of all of this. And that is to assign a COVID prevention coordinator to become an expert in state and local guidelines. With this expert, you need to establish a committee or a group with representation from all levels to really develop a good prevention plan. And along the way, really ensure management buy-in to all aspects of this plan and communicate this plan clearly and often with employees at all levels, both regarding what the plan is and each person's individual expectations under the plan. And then really important to consider all aspects of your operation in your plan. And when I say all aspects, I'm talking maintenance activities. I'm talking about the routes people take to come into work and leave work. Everything that happens at your workplace, you need to think about in a new light in terms of COVID. So the first thing, keeping people with COVID out of the workplace. I think the most important thing that anyone can do is really have good policies around paid sick leave and quarantine and isolation leave. We really need to do our best to remove motivation for sick people to come to work. And that's also making sure that we train employees on the signs and symptoms of infection, which it seems like everybody should know these things by now. But I think it's really important to make sure employees are very clear on what this disease looks like, even at its earliest signs. It's also important that employees know how and when to call in sick. And then we want to think about doing things like pre-shift temperature and symptom screening. And there's a number of good guidelines out there to really help you establish those plans. And training managers and supervisors in how they can recognize sick employees and send them home during the day. And making sure you really have a solid plan for how to send these employees home. And an even more solid plan for procedures for these folks returning to work. The next principle would really be keeping people apart. And keeping people 6 feet apart, at least 6 feet apart, is really one of the most effective things you can do to prevent transmission in the workplace. And one of the things that can really help with that is to allow people who can effectively work remotely to continue to work remotely, keeping those people out of the workplace. Also important to really think about remote work accommodations or other options for high risk employees. Those people over 60 as well as those with chronic health conditions. And then when we talk about 6 feet should be considered an absolute minimum distance for extended work. And when I say extended work, I mean work that occurs over longer than a 15-minute period. And so that really means that we should try to keep desks at 6 feet apart at a minimum. Also thinking about eliminating meetings of more than 10 people, thinking about other places where employees congregate, like lunch and break areas, and making sure we space those areas out to prevent groups of people to congregating. And then when we think about areas in our facility that are really prone to crowding, places like locker rooms, time clocks, entrances, and exits, really trying to implement physical distancing cues, markings on the walls, markings on the floors in these areas to remind people to stay apart from each other. And then one thing I've seen that has actually been effective in some places is designated physical distance coaches. And these are people who stand in places where you tend to be pinch points in a facility, and they remind people to stay apart. And then they also monitor for new areas of crowding in the facility and report back to provide solutions for those areas. If we can't keep people 6 feet apart, we need to really think about barriers when this distance can't be maintained. And I'm sure everybody's seen these barriers at grocery stores and convenience stores. And this is really transparent barriers in places like reception areas, temperature screening areas, customer service counters, and even in production lines where they just can't be spaced out enough. As you see on the left there, that's a meat packing production line. that they can't space out, and they have the plastic barriers between the workers. Also important that barriers shouldn't be a substitute for using face coverings. Barriers should always be used in conjunction with face coverings. The next thing would be to use face coverings when distance cannot be maintained. And you notice I'm saying face coverings and not masks. And I want to make sure that it's really clear that we are talking about not respirators, we are talking about face coverings. And face coverings in this context are really used to reduce the amount of viral particles that infected people shed in the workplace. Face coverings are not personal protective equipment. They do not protect the wearer. They protect people around the wearer from the viral particles emitted by that person. And in the workplace, these should be used at all times when not eating or in a person's personal and appropriately distanced workspace. These face coverings should meet CDC guidelines, and CDC guidelines say they should have multiple layers of fabric, they should fit snugly to the face, covering the nose and mouth, and allow for breathing without restriction, and be easily cleaned or laundered. And the easily cleaned or laundered part is really important, that people clean these masks, take them home and wash them to make sure that they don't get contaminated over time. And then washing hands often. You know, it feels kind of funny to be telling adults to wash their hands often, but this is a really important part of the hygiene plan of a company. And employees need to be trained on how to proper hand washing technique and on proper use of hand sanitizer. Believe it or not, there's a proper way to use hand sanitizer and an improper way. We also need to think about allowing employees breaks at least every 30 minutes to wash their hands. Installing hand sanitizer dispensers at strategic locations throughout the facility, places like reception desks, entry and exit points. And then installing signage like the sign on the left there to remind employees to wash their hands is also important. The next guideline we need to think about is cleaning and disinfecting often. Um, I think it's a good idea to disinfect personal workstation surfaces daily and disinfect high-touch community surfaces like doorknobs, handles, elevator buttons, bathrooms, those kinds of things, multiple times per day. In environments where their tools are used and tools are shared, tools should be disinfected before sharing or before moving to a new work location. When disinfecting surfaces, you should always use an EPA registered disinfectant for use against COVID-19. When you're looking it up on the EPA website, it's going to say effective against SARS-CoV-2. So just so you don't get confused there. And then the thing that we see the most often is that people aren't using sanitizers correctly. They're not following the directions on the bottle. And if you look at the directions on the bottle of a disinfectant, you will see that it will say you need to allow it to remain on the surface for a certain amount of time. This contact time is critical for really getting the virus killing action that the disinfectant is supposed to have. So please follow those directions. And then the next thing is really to communicate across all organizational levels. This is the place where plans often fall apart. And you need to communicate the plans and policies multiple times through multiple methods to make sure everybody gets the message. And then have the plans and policies easily available to all employees, and to ensure that employees, supervisors, and managers know their roles and expectations under the plan. And then, unfortunately, we always have to have a plan for reinforcing compliance with the established policies. These are new safety rules. They need to be enforced in the same way you have any other safety rule in the workplace. And then, most importantly, we need to make sure that the leaders at our work sites really understand the need for modeling safe behavior and actions as it pertains to the COVID prevention plan. Then we get to the last piece, which is really hope for the best and prepare for the worst. And this part is really to make sure that you think through how your workplace will respond if or when you identify one or more cases in your workplace. Make sure that you know how to report a case, know who to contact at your local health department. Understand that it is an employer's responsibility to do contact tracing at the workplace. And what that means is that somebody at the workplace needs to be able to identify all close workplace contacts. And when we say that, we're talking about 15 minutes or more within 6 feet is considered a close contact. And you need to be able to identify those in the 48 hours prior to symptom onset or positive test. So thinking through the worst case in planning your work and thinking about how you're going to keep track of who people have close contact with is really important in all aspects of your plan. Also important to think through the needs for remote operation should you be required to close your facility again. And really, since we don't know the effectiveness of these controls, to plan for evaluation of your prevention program should a case be identified. To go back and think through, how could this have happened and what could we do different to prevent it in the future? So those are the guidelines. And, I get a lot of questions around, might anything else help? And I get a lot of questions around airflow, filtration, and air exchange rates. And things to think about in terms of reopening your facility. I think it's really more important to consider the direction of airflow and how workstations are located, and to think about making sure that airflow blowing from one person to another is avoided. And in thinking about this picture on the left here, this is a picture from a CDC report from spread in a restaurant, where they really found that this air conditioner blowing air towards this exhaust fan over here was able to carry these viral particles a pretty good distance and get cases further away than the 6 feet distance. So really thinking about positioning of employees as it pertains to the direction of airflow is important. And then also general recommendations would be, especially now, consider increasing the air intake of the facility, the outside air intake. This will increase the air exchange rate. This will dilute the concentration of virus in the environment, as will upgrading filtration in the building to filter out these particles as the air gets recirculated. And then really a simple solution is to continue to run a ventilation system after hours, which will provide additional air cleaning and further reduce the concentration of viral particles in the environment. And then, you could also think about things like portable air cleaners in certain spaces that can provide additional filtration and additional effective air changes. So with that, I've listed some resources. I think people know how to get a hold of the Colorado Department of Public Health and Environment. There's also contact information for OSHA as well. And OSHA does take employee complaints regarding COVID. And then a resource that some of you might not know about, they really can provide some individualized attention, is the CSU Health and Safety Consultation Program. And this is a staff of safety and industrial hygiene professionals that are really designated to provide assistance to small businesses. So they have staff on call now to really help employers with COVID-related issues. Most of it has to be done remotely, but there's definitely some possibility for resources there. So with that, I think I'm gonna stop sharing, and I think we're going to go over to the Q&A.
We will. I want to thank you, Mike. Hi, everybody. Lee Newman here again, and welcome. And I'm glad you're all here. I wish we weren't here. And what we'd like to do now is I've been tracking the questions that have been coming in, and I'm going to try to group some of these. We have Catherine Buchema and Mike, and sometimes I might even chime in on some of these questions. So we're going to spend the rest of the time fielding questions. I want to remind people that if you're looking at submitting a question, go to the Q&A tab rather than the chat tab, because that's it's hard for me to look at both at the same time in terms of pulling in some of these questions. One, Mike, that I want to have you touch on, because I've gotten a couple of questions around this, is for a little bit more information on ventilation and HVAC systems. So one question is, where can people get more information about the CDC study of the restaurant, was one question. And there's another question about operating HVAC systems and how much outside air to be bringing in. Is the answer to bring in as much outside air, makeup air as possible? What's the guidance on that?
I mean, the guidance, especially this time of year, 100% outside air. Open your dampers wide open to get as much outside air as you can, to the extent that the system will operate in that mode. More dilution. We always say dilution is a solution to pollution, and it's really no different for COVID. Diluting the concentration of virus in the environment is really a good idea as well. So more outside air is good. There's more information on the ASHRAE website. So definitely go to ASHRAE, who's the American Society for Heating, Refrigeration, and Air Conditioning Engineers.
Great, thank you for that. A question that I want to direct to you, Catherine, and maybe Mike, you have a perspective on this as well, is one question is, how soon, in terms of days from the time that somebody has their exposure to virus, can an individual start shedding that virus?
Thank you for the question. I'm happy to answer. As far as when a person will start shedding the virus, according to the CDC, it's not exactly known when they will start shedding. And that is part of the problem and part of why we are taking all of these precautions in the workplace and elsewhere to try to stop the spread of the virus, because we aren't sure when the shedding first occurs. As Mike stated in his presentation, the shedding is now known to possibly continue much longer than we had thought.
Mike, you have anything that you want to add to that?
No, I think that was a good answer. Thank you.
Great.
Thanks, Catherine.
I want to just flag for people as a thank you. We have people who are participating through the Q&A and providing some additional resources and references. So as you're listening to this Q&A, take a look at the Q&As, because we're seeing some great input from the audience. So thank you to those of you who are offering that content. One of the other questions which I'm seeing run through here are still some questions around the face coverings. There seems to be some uncertainty about the recommendations about how much of the day at work do I need to be wearing my face covering, and also a question which had been asked previously but wasn't answered on an earlier session that we did, is if you're trying to disinfect your face covering, Mike, can you iron it? Would ironing be sufficient if you don't have access perhaps to washing facilities?
Ironing would be sufficient. I mean, that heat would destroy the virus. And I think it's always better to, washing would probably be better, but if it's not available, I think ironing would be sufficient. In terms of when to wear the face mask in the office, and we'll just think about an office environment. I mean, I think the general guidance is when you cannot maintain a 6-foot distance from everybody else in the office, you need to be wearing that face mask. Now, I would say that some people would say, I'll be wearing my face mask all the time while I'm in the office, and I think that's okay. I think that should be an individual choice as well. But definitely, when you can't maintain that distance, is when you should be wearing the face mask.
As an add-on question to that, what about the use of face shields? Is that something that should be more routinely done, or what's the recommendations for when face shields should come into play here, Mike?
I mean, I think that's harder, and it depends on the kind of employment we're talking about. And since we're not talking about healthcare, I think in a non-healthcare environment, when a face shield should be considered is, I mean, let's say you're working on a production line and you can't install a barrier between you and the person that's closer than 6 feet to you. So I think a face shield would be a good add-on to a face covering in that instance, when you do have closer than 6 foot contact long-term during the day.
And another direction I want to take this has to do with transportation. We have a couple of questions that have come in around the use of public transportation. If I assume if you're coming to and from work on public transportation, you and I have done some consulting where the issues come up of people carpooling. There are also people who, as part of their job, use cars that are supplied by the employer, and so they're fleet vehicles, for example. What's the guidance around transportation?
I think the current guidance is, distance yourself as much as possible, first and foremost. And now face masks are required to ride on public transportation. So everybody needs to be wearing a face mask, which that'll help a lot in terms of the overall viral load in those spaces. I think in terms of carpooling, when you're carpooling, everybody should be wearing a face mask as well. And just to remember that the goal of these face coverings, I used mask, sorry, I should have said covering, is really to catch a lot of these particles that are exhaled or coughed out so they don't get into the environment. So reducing that at the source is really important.
And as far as wiping down surfaces, should we be carrying around our Clorox wipes and sanitizers? And what do we do when we're the one who has to use a shared space, a shared vehicle where we might have contact?
I mean, I think if you're going to spend a long period of time in a shared vehicle like that, or possibly in an airplane, it might be a good idea to be able to wipe down the surfaces around you. But really, the goal would be, if you touch these surfaces, don't touch your face, and wash or sanitize your hands often while you're in these environments. So if you can't clean it, make sure you are very cognizant about touching your face with your hands.
We know how hard that is to do.
It's really hard.
And all these recommendations, I think one of the things that I'd like you to comment on, Mike, is, even if we do all of these things, what's the probability that we're still going to have breakdowns where there may still be people who expose others in the workplace, or perhaps even become sick because of the workplace?
I think as an industrial hygienist, we think about things in terms of a hierarchy of controls. And we think about being able to control an exposure without any input from an employee is really the best way to go. So the only way we could be 100% sure that this doesn't happen in the workplace is that no sick employee ever goes into the workplace, which for this particular disease, that's virtually impossible. And then we're next going to rely on administrative controls. All of these things that really rely on employee behavior to wear their masks, to stay 6 feet apart, to clean surfaces. I think it's going to require a high level of compliance to really prevent this from happening in the workplace. So I think the lucky thing is that, there are a lot of cases in the community right now, but the odds of having a case in any one business still remains really low. So what we're dealing with is really a low probability, high severity kind of situation here, where if we have one miscue, we could have a huge outbreak. And it will happen. We just have to make sure that we are really vigilant in our workplaces to follow all these guidelines.
And we've seen the outbreaks. We've had them in grocery. We've had them in long-term care facilities, manufacturing, in the meat processing industries. You can go down the list. What I've heard one executive say is that their worst nightmare is the thought that they would be reopening their business and they would become one of those outbreak sites. And I couldn't reassure them that by doing all of these measures that you've described, that wouldn't happen.
And I think we all need to realize that all of these things that we've heard about, meat packing, distribution centers, there is nothing special about these environments that makes it easier to spread COVID virus in these environments. The only thing special about these environments is that people work close together. So any place that people get close together for a long period of time, they're at the same risk. So I think it's really important to remember that we're not that different.
So I want to turn back to the office environment, and we have a very popular question that's come up. Given the risks, as an office-based business where telecommuting is an option, what are the benefits of holding off and avoiding any return to work? And the kicker question is, how will we determine when it is safe? And I'd like both Mike and Catherine to answer that question.
I'm happy to jump in first.
Go ahead.
If you don't mind, Mike. So in my opinion, if your workplace is one in which you're able to telecommute and therefore increase social or physical distancing, I think that that's a great idea if that's feasible. And as far as when it is safe to return to work, that is, of course, a question that everyone's asking right now. But we talked a lot about flattening the curve, and Colorado's been doing a very good job of trying to decrease the number of cases and deaths. And so as long as that continues and your local and state and federal authorities are giving you the green light to go ahead, then it might be time to consider returning to work in a staggered fashion as seen by the different federal guidelines that are available.
So from my perspective, I think that if you can work from home, if you can get your work done, if you can be just as effective working from home as you are from the office, there's no reason to go back to the office right now. I think that determining when it's safe is when we really have a fairly long-term sustained decline in cases. We're able to test the amount that needs to be tested and follow up on those tests. And I think we're going to have, different areas of the state that are able to do those things quicker than others. So I think it's very local, and I think really listening to your local health department on that issue is really important. So yeah, that's about it.
A point that was made by one of our attendees has to do with something you were talking about, which is really more on the collaborative side of addressing this with the workforce. And you talked, Mike, about having a committee. One of the comments that was made was that that health and safety is a mandatory subject of bargaining, and if you have a unionized workplace, management must not make unilateral changes in health and safety without notifying the union and providing that opportunity to bargain, and that's NLRA. And so it's just a point that I think appropriately somebody did raise. And so if as we are engaging our employees, let's remember that we still have some principles of engagement with unions and other representative groups. And I don't know, Mike, if you have anything else that you want to add to that point. I think it's an important one to add.
No, I think so too. I mean, I think a lot of times, when we think about this subject, we're kind of thinking about office-based environments and non-union environments. And I think even in a non-union environment, it is critical to really involve employees in the decision-making process. When you do have a union involved, labor has to be at the table too. So I should have put that in there. Thank you for bringing that up.
Yeah. One of the questions which is I think important for us to wrestle with, and Catherine, I'd like to direct this to you, is that if you're in a situation where in your workplace the employer becomes aware that somebody is COVID positive or suspected positive or even has symptoms and is later discovered to be diagnosed with COVID, what should be the actions taken by the employer? And I mean here very practically, like what kind of information should be shared with other employees, what information should be gathered about potential contacts, what counts as a work-related contact, and if we sort of walk through some of those scenarios, because I think that's kind of a tricky area, and it also does cut into the area of personal protected health information. So maybe Catherine, if you could touch on this, and then Mike, I know you and I have wrestled with this with some consulting activities.
Sure, thank you. I'm happy to answer that. So as far as a contact is concerned, you really want to try to find out, first of all, who they came in contact with, meaning within 6 feet and for at least 10 minutes. And you want to find out who they came in contact with within 48 hours of their symptoms appearing. So 48 hours prior to those symptoms appearing. That's really where you want to go back and look to see who these employees were in contact with. And it does get a little tricky as far as sharing information, but really it's the best way forward is for that employee to share the information with you that they are positive, and then for you to be able to contact the others. You don't need to give anyone specific names. There's absolutely no need for that, but definitely let the other employees know that they have been in close contact with an employee who tested positive. And in that case, they should go home from the workplace. If there is an occupational medicine clinic on site or any sort of health clinic on site, they should be seen there. And generally, the people in that clinic will be taking care of this sort of work. And they will go ahead and record this information and then make sure that the person has the proper PPE in order to go through the workplace and leave that day, and make sure that they are checked up upon while they're at home. Now, as far as them returning to work, I don't know if you want me to touch upon that as well, Dr. Newman. Okay, happy to do that. So essentially, if a person with COVID-19 had symptoms, essentially, they may come home, they may return to work from home after at least they've been home for at least 10 days since their symptoms first appeared, and at least 3 days or 72 hours have passed since their recovery, which is defined as no fever, without use of any fever-reducing medications, and improvement in their symptoms, especially their respiratory symptoms. So in other words, they're not coughing. And of course, they don't have any shortness of breath or anything like that that we would be concerned about. The other strategy that can be taken for those who were found to be COVID-19 positive would be a test-based strategy. Now, testing is still not as easy to come by as we wish, but I will mention it. And essentially, these people, employees who have tested positive for COVID-19 and who had symptoms, they may return to work after they have the following. They have to have resolution of their fever without fever-reducing medications as before, improvement in their respiratory symptoms, so in other words, again, the cough or shortness of breath, and negative results of, it has to be an FDA approved COVID-19 molecular assay, so test for, so at least 2 of those consecutively collected greater than or equal to 24 hours apart. So a total of 2 negative tests. So those are the 2 ways they can come back to work.
So Mike, following up on that, what's the obligation of the employer to do this kind of tracing, tracking, and testing? If there's, I don't know that, maybe that's an unfair question because I don't think we have the pat answer, but I'd like your perspective on it anyway.
I really think it's twofold. I think first and foremost, you know, we are implementing a bunch of prevention strategies that we are not sure what the effectiveness of these prevention strategies are going to be. So from an evaluation standpoint, it's really important to trace back where this could have occurred and who else could have been exposed. Now, once you have 2 cases, local health departments will be getting involved in doing contact tracing for you. Now, I know that the local health departments will do all of the contact tracing that occurs outside of the workplace. It's a little unclear of how much of that they're going to do inside of the workplace. So I really think that there will be an expectation of employers to be able to provide the list of close contacts within the workplace to the health department when this contact tracing starts, should they have 2 cases. So, and I think there's a responsibility to think about how we organize work to really think about being able to track those close contacts during normal work. So whether that's a plumbing company who keeps track of all the customers they went to, or that's a maintenance man inside a facility who has work orders of all the places he's been over the last week, or if it's an office employee who has records of meetings that they went to and the people that they talked to. I think there is a responsibility to do that and a responsibility to think about that before it happens.
Yeah, thank you for that. We're just going to have time for 1 or 2 more questions. I want to alert people who are following the Q&A. I want to thank Jamie Backus for providing some good resources on UV light. And there are some questions that we have around disinfection. But I want to shift gears to one question that's come up and many people are asking. Mike, is it the employer's responsibility to provide sanitizer, cleaning products, and face coverings, et cetera?
Sanitizer and cleaning products, definitely. From a face mask perspective, in a normal environment, yes, it would be the responsibility of the employer to provide that. If they're going to require employees to wear it within the workplace, they should be providing it. I think there's a lot of problems with availability that remain, that we've kind of sidestepped that question a bit for starters. But in the long term, I think it is the responsibility of the employer. As far as how that sorts out in the law, it'll be interesting to see. I don't think we've ever been in a situation like this before.
Yeah, I'm assuming you're basing that on the existing premise that it's the obligation of the employer to provide a safe place of work for all employees.
And it's the obligation of an employer to provide workers with required protective equipment.
So on the flip side, is there an obligation, is there a regulation requiring an employee to notify their employer if they test positive?
I don't know if there is or not. See, all those legal questions.
And yeah, and I want to disclose that none of the 3 of us are attorneys.
Yeah.
Related to this, are there HIPAA concerns as far as if those test results get reported directly to an employer?
That sounds like a Catherine question.
Can you repeat the question? So if are there HIPAA concerns if the results of an employee or the employer?
Right, yeah, if the employee tests positive, Is there a HIPAA concern about that result and the name of that employee being provided back to the employer? That's how I'm interpreting the question. These are some tough areas, right?
They are, and there was some flexibility that was provided around HIPAA when the pandemic started, because they realized that we needed to, of course, continue with our privacy laws and continue to have HIPAA, but we needed a little flexibility in order to allow for something like contact tracing to occur. So, whereas, of course, there's always a concern, it is allowed in this pandemic, yes.
I think some of the things that we have to be aware of is that there are appropriately fears about discrimination and the misuse of information. I want to remind people that employers are not to be asking about medical conditions. An employee can offer that information, but an employer is not in a position to ask someone to disclose a medical condition, including whether they're COVID positive or not. As frustrating as that may be to some of us, there are reasons why we have those protections in place. I want to, at this point, turn it back over to Lily. I want to thank everybody. I want to thank the panelists especially for fielding some really tough questions. We have more. We're going to do this again. Lily, invite us back, and we'll be here because the questions that are still here are important to answer, and some of the answers are going to change as more unfolds. So thank you, Mike, and thank you, Catherine, today. Back to you, Lily.
Thanks, Lee, and thank you, Mike and Catherine. Really great discussion, and thanks to all the attendees who asked such great questions. As I mentioned at the start, we will plan on scheduling a follow-up to this so that we have an opportunity to continue the conversation. So as far as there was a lot of questions that were coming in on where to receive links to previous town halls. I'll direct you to that, and you'll be receiving a follow-up email tomorrow with links to the recording for this presentation, including the panel discussion, as well as a link for upcoming webinars and town hall series. We have a webinar coming up next week on resiliency and mental wellness in the workplace. Mental health and stress continue to be the #1 concerns that employers that we're surveying right now are expressing as their top concern for employee health. So I think it's important we continue to provide this type of information. And so we'll have Dr. Chad Morris, who's the Director of Behavioral Health and Wellness, the program here at the University of Colorado, Denver, presenting next Wednesday. And you can find a registration link for that on our website. We're also offering a free consultation through HealthLinks Advising to employers that are interested in talking directly with one of our advisors and have the opportunity to ask questions related to what we talked about today for guidance on return to work. So please get in touch with us if you're interested in scheduling an advising session. And as I mentioned, you will be prompted to take a quick survey when we close out of this webcast, and you can connect with us through HealthLinks or through the Center for Health, Work, and Environment directly. Google is the best way, or shoot us an email at contact@healthlinkscertified.org, and we'll make sure to respond as quickly as possible. But thanks again to our presenters, our panelists today, and we look forward to seeing you all soon. Wishing you safety and well-being. We'll talk later. Thanks.